A Marine Corps flag waves outside the home where veteran Jerome Newberry lives with his daughter and son-in-law.
I brought him out here to live with us in California because I felt he may not be getting the best care in St. Louis.
Linda's dad was a teenager when he joined the Marine Corps.
It was 1954 and I was 18. Proud to wear the uniform, that's for sure.
Corporal Jerome Newberry served 3 years.
I was a lineman, ran a radio and telephones. We were up with the infantry and we would call back fire missions.
He remembers many of his fellow Marines.
Gomez.
And he wears his cover to this day. Besides the experience and memories, Jerome earned something else that was there when he needed it.
I had cancer, and cancer gets expensive.
So he enrolled with the VA and accessed his health benefits.
If you can't afford it, you better go to them because they'll cover it for you.
And the VA has been there for him, covering doctor's visits, medications, and supplies.
My hearing aids, that Walker over there got that out here for free.
Jerome has been battling cancer in his spine. Recently, he and his family made a difficult decision that requires different care.
Reality is that the cancer is going to win, and so we decided to go for quality of life over quantity and stop the treatments that were making him so sick.
In collaboration with the VA, the Elizabeth Hospice is covering his hospice care, physical needs, as well as emotional needs for the entire family.
I've never been down this road before. They have been there to answer any questions and send help and equipment.
Jerome and Linda are sharing their story to urge other veterans to apply for VA benefits now so they're in place when needed.
I encourage you to enroll in the VA early. It's worth every bit of your time because the benefits are so worthwhile, making your life easier and better and quality of life. Peace of mind, too.
You put in your time and you get rewarded that way.
Hi, I'm Geraldine Kwan. I'm from the County of San Diego, Office of Military and Veterans Affairs, and I'm here to discuss with you Live Well to Serve Well, and a little bit of an idea of benefits the VA has to offer. You're probably wondering what we do. We're part of CalVet, the California Department of Veterans Affairs, and also the VA, and we offer a variety of programs. We take care of CalTAP, college fee waivers. We also have home loans, and we have cemeteries, also a variety of education benefits, and also housing and homeless programs. This is what the OMVA offers: comprehensive benefits counseling, disability claims preparation, submission, and appeal. Only authorized approver for the CalVet college tuition fee waiver and veteran driver's license designation. We're also there for information and referral and for outreach. There's a structure to the VA. There's 3 branches: the Veterans Health Administration, the Veterans Benefits Administration, and the National Cemetery Administration. Some people get confused. Isn't it all the same thing? No, there are 3 separate entities. You are eligible to enroll in the Veterans Health Administration if you served in the military and did not receive a dishonorable discharge. Now, let's take a look at a few VA benefits you might be eligible for. 2 VA programs provide certain elderly veterans with an additional monetary amount if eligible for or receiving a VA pension benefit. Aid in Attendance is a monthly pension amount paid if one of the following conditions are met. You require help performing daily functions, which may include bathing, eating, or dressing. You are bedridden. You are a patient in a nursing home. Your eyesight is limited to a corrected 5/200 visual acuity or less in both eyes, or concentric contraction of the visual field to 5 degrees or less. A veteran is eligible for aid in attendance if the veteran is at least 65 years old and served at least 90 days of active service, including at least 1 day of active service during a period defined as wartime. If the veteran served after 1980, he or she must have served 2 years of active duty plus 1 day during wartime. 30% or higher service-connected disability. Exam by a VA physician required to certified need. Aid and attendance applicants must meet certain low-income and asset limitation. Additional VA benefits for elderly veterans include housebound is an increased monthly pension amount paid if you are substantially confined to your immediate premises because of a permanent disability. If you are a surviving spouse of a veteran, you might be eligible for this benefit. Extended care, also known as long-term care, is a program for veterans of all ages who need the daily support and assistance of another individual. Elderly veterans can receive geriatric and long-term care programs at home, at VA medical centers, or in the community. And it could be somebody in your family that can help, and they be paid for those services. The program also extends to nursing home and residential care. Some of you are probably wondering, what is service-connected disability? What service-connected disabilities are, that's any condition, injury, or disease caused by, aggravated by, or first diagnosed during military service while you are on active duty. That's what is called service connection. And as long as it is chronic in nature and has residual effects. This is an illness or a disease that you're still getting medical service for, and that means it's continued on in your life long after you have left active duty service. What is required for service-connected disability? It is incumbent upon the veteran to substantiate an injury or illness occurred during military service and link between military and current condition. And one of the things people think, oh, well, I have all that, but you have to prove whatever it is that you have in illness or condition, and that's what requires all of the time and medical substantiation. So it's really important that if you still have this condition currently, that you are being seen for it. We'd like to move on to assisting families with burials. The eligibility, the burial flags, headstones, grave markers and medallions, presidential memorial certificates, and monetary benefits. How do you qualify for burial? One of the things that we have is the National Cemetery Administration. This is a good informational brochure on the national cemeteries and also the services. If you were honorably served in any of the military services and you have an honorable discharge or a DD-214, you're eligible for burial. It's also in our Veterans Resource Book. There's a section on burial and who's eligible. I also wanted to refer to the initial steps during a veteran's death that outlines every step what to do in case a veteran passes away in your family. It also tells of the national cemeteries in our area that you're eligible for burial, which is Miramar National Cemetery, Fort Rosecrans, and also Riverside National Cemetery. It's all outlined in this booklet. Let's talk about survivor benefits. If the spouse of a veteran needs a little financial help after the burial, what is it that we help with? We pay the surviving spouse or an eligible child of a service person special benefits if the veteran died on active duty or died during a service-related condition. And this money is monthly tax-free benefits. You do not pay taxes for that. How do we do this? How do we get things going for the veteran? We help the veteran complete an intent to file. You have 1 year to file your claim. And during that time, it's evidence gathering. Is it in your service record? We need to know. You need to gather all of your service records, gather current treatment record, gather additional medical opinions if necessary. It can be private or it can be with the VA. The next step is to make an appointment and meet with a VSO, a Veteran Service Officer like myself, to file your claim. Attend compensation exam, and you wait for a decision. It's not fast, it takes a while, but you get it done. We have 4 locations that you can reach us at for help, and they're listed for you. If you need additional services nationwide, you can contact the National Association of County Veteran Service Officers. You can go on the website and click on by state, search by name, and search by county. If you wanted to contact me, you can use the information that's listed on the screen, and I'll be glad to help you. We look forward to serving you and hope you contact us soon.